Future Career Decisions, Part 2. There's a lot of professional organizations for nursing as a whole and for specialized nursing fields. The National League for Nursing, or NLN, is for all levels of nurses. They are the ones that push for curricula reform. The NLN promotes continuation of practical nursing. The American Nurses Association is for RNs only, but it is being altered on the state level to allow LPNs to join, but they don't have a voice. So still basically, even though LPNs can get involved with it, it's still for RNs only. The National Association for Practical Nurse Education and Services, or NAPNES, is for LPNs, RNs, and student nurses. It is a networking education it offers networking, education, and insurance discounts. It's the first organization to promote LPN nursing schools and continuing education for LPNs. And the National Federation of Licensed Practical Nurses, NFLPN, is for LPNs and student practical nurses. It is the policy-making body for LPNs. NLN has competencies that promote human dignity, integrity, self-determination, and personal growth. They have competencies that provide rationales for the judgments that's used in the provision of safe and quality care. Employers can pick up part or all of a fee for continuing education if it benefits the agency. For example, I was employed in the intensive care unit, and part of the requirement to work in intensive care was to maintain a current certification in ACLS, or Advanced Cardiac Life Support. So the facility paid for that continuing education for me every 2 years. Continuing education includes the following resources. There might be orientations where you learn about policies, regulations, routines, nursing care procedures, and variations in routine. It might include in-service training, which focuses on the specific needs of a facility. There might be workshops where you learn new skills, and these are the major sources of CEUs, continuing education units. CEUs often teach complex nursing skills such as IV therapy and physical assessment. There's also internet resources such as podcasts or Medscape, etc. NAPNES has several certification programs. Actually, just a couple here, with long-term care certification and pharmacology. These certifications are comprehensive and with the long-term care, and it covers the entire lifespan of patients who are chronically ill in any age group. The nurse must have a current license in good standing and have documented 2,000 hours of long-term care practice within the previous 3 years and receive a passing grade on the examination. With pharmacology, you are tested on the general principles of pharmacology, the role of the LPN with pharmacology, drugs that affect different systems, and the nursing process for the patient receiving medications. Anyone can test who holds a current LPN license or a student who meets educational requirements to take the NCLEX-PN and receives a passing score on the pharmacology certification exam. NFLPN has certifications in IV therapy, gerontology, and foot care. The IV therapy certification includes fluid, electrolytes, and acid-base balance topics, fluid administration, the administration of blood products, of total parenteral nutrition, medication administration, and special considerations that include legal, pediatric, and infection control. Gerontology topics include foundations of gerontology, promotion of health and wellness, nursing care of the elderly with physical and psychological disorders, and special gerontology care issues including rehab and restorative care, substance abuse, cancer, and pharmacology. And the foot care certification is a new certification program. It's online training and it involves an internship. And ABMCN has a certification in managed care. This examination includes basic knowledge of managed care, of healthcare economics, healthcare management, and patient issues. So when you graduate from the LPN program, don't be pushed into furthering your education if you're not interested or you're not ready at this point. Life happens and we understand, but don't let anybody push you into something that you're just not quite ready for. We do encourage you, though, however, to continue your education as far as you can go. As we've told you from day one, nursing is a lifelong learning process. So looking at educational mobility for nurses, there's some career ladder programs. These are otherwise called seamless programs that are carefully planned to avoid duplication of content. The curriculum is a practical nursing curriculum for the first year and an associate degree nursing curriculum for the second. It's a totally new curriculum designed in terms of essential learning for beginning nursing competencies. It allows the student to be a competent practical nurse at the end of the program and a competent registered nurse at the end of an additional year. Noncredit RN programs. There's some RN programs out there that do not recognize LPN programs as being sufficient prerequisites for coming into their RN program. So be very careful when you're looking for an RN program. Many of the programs do have websites that make it possible to get some information about the program before you inquire directly. And you should also request a list of board-approved professional nursing programs that prepare for the registered nurse licensure that are open to LPNs.